Hi, welcome to the Golden Years. I'm Lori Betts, and today we have Dr. Lisa from Medina County Health Department, and we are going to be touching the subject of the upcoming flu season. So please stay tuned. We'll be right back.
There are heroes among us. They don't fly or bend steel or ride off into the sunset. They simply volunteer to look after someone else's health by providing comfort, lending a hand, or simply keeping us on track. Everyone's health needs a hero. Who will you look out for?
Find out how you can participate in improving our health. Visit iparticipate.org.
Dr. Lisa, please introduce yourself to the audience.
Hi, Lori. Thanks for having me on the show. I'm a medical epidemiologist at Medina County Health Department. I've been there for about 6 years, and I deal with communicable disease, including influenza.
Share with us what is all about the upcoming flu season. What do we need to do? What do we need to look for? Give the audience some tips.
Well, first let's define what influenza is. Influenza is an acute respiratory illness. It is very contagious, and it is the most common cause of vaccine-preventable death in the United States. It is caused by a virus. There are several kinds of influenza virus that can be vaccinated against. Influenza in people is either caused by an influenza A virus, which is found not only in people but in animals, especially in pigs and in birds. There's also an influenza B virus that's in the vaccine. This virus is only found in people, and it doesn't tend to be as severe an illness as influenza A. Influenza A is the virus that occurs in pandemics every once in a while. This is when influenza illness spreads worldwide because of the development of a new strain of flu. So when we're talking about pandemics, and generally with very serious illness, we're talking about influenza A.
And what's the difference between a pandemic and an epidemic of the flu?
Well, an epidemic of any illness is when you see more cases of that illness in your community than you normally see. A pandemic is when you have an epidemic that spreads worldwide. And influenza pandemics do occur several times, usually several times a century. They're not very common. There were 3 pandemics in the 20th century, the 1957 Asian flu, the 1968 Hong Kong flu were the most recent ones. And then it was over 40 years before we had another pandemic, and that was, of course, the 2009 H1N1 influenza pandemic.
What age group should get the flu shot? Should we all be concerned?
Well, currently, and this is a new recommendation this year, it is recommended that everybody age 6 months and older get a flu vaccine. And this is because influenza can affect anybody. Anybody can get complications from influenza, although it is more common in certain groups of people. But anybody can get the flu, and anybody with the flu can spread it to other people. So even if a person is healthy, if they get the flu, they can spread it to people that either have a chronic illness or people that are very young or very old. And those are the people that are at highest risk of complications from influenza. Children under 2 years, adults 50 and over, and anybody with any chronic serious medical condition like heart disease, for example, congestive heart failure, or valve disease of the heart, or coronary artery disease. People with underlying lung diseases like asthma or emphysema or cystic fibrosis, those people are also at risk of complications. Pregnant women And also people that have any problems with their immune system. They are also at increased risk of complications. And these complications can be severe. Most commonly, pneumonia is a complication of influenza, and influenza can be fatal in those people that have complications. It's estimated that about 36,000 deaths a year occur in the United States.
And a lot of people are fearful of having the vaccine because they assume that they are going to be sick right away.
From
Is
the
that just
vaccine.
from the vaccine.
It's one of the myths is that you can get the flu from the vaccine. There are two different vaccines available. Let me speak first about the flu shot, which is an injected, it's the injected form of the vaccine.
Painless.
It's not too bad. It is a shot, so there are side effects, usually mild. The side effects can include pain at the injection site, of course, mild swelling, stiffness of the arm, and some people get some mild, more general flu-like symptoms like body aches or headaches. These usually go away in a few days, but sometimes those side effects are confused with influenza itself. Side effects, when they develop, and they don't develop in everybody, most people don't have any side effects from the vaccine. When they develop, they are generally much milder than having the flu itself. The other thing that can happen is that somebody may get a flu shot and already have been exposed to a cold or influenza or some other virus. And the vaccine takes 2 weeks to develop protective antibody, and actually takes a few weeks longer than that for that antibody to peak. So it's always possible that even though they got the shot, they were already exposed to an illness, and unfortunately at that point the shot will not prevent that infection from developing. So those scenarios can lead people to think they got the flu from the flu shot. Mm-hmm. And it's really not possible, because the flu shot is an inactivated or killed virus, and it cannot reproduce, can't cause the flu infection itself.
Well, the shot was never a priority on my to-do list, but like for 5 years I've been a caregiver for my mom, and I go in and out of hospitals, nursing homes, and I figured I could be a carrier very easily. And I was taking care of my niece's kids too in the morning, and they're at daycare and they're at school. So I started getting the shot, and I think I felt better through the entire flu season.
Remember, when you get a flu shot, you are not just protecting yourself, but you're protecting other people that you could be exposing to influenza. And one of the things about influenza is that people can be contagious even before they become ill. So they can be contagious, in other words, spread the illness as long as a week afterwards, even a little bit longer in children. I mean, if the child has the flu, mm-hmm. they are contagious a little bit longer. But anybody with influenza can actually start shedding the virus and spreading it even before they know they have it, up to a day before.
Is it ever too late in the season to receive a shot?
No, we certainly recommend people get it as soon as it's available. There actually used to be some concern about giving it too early because it was thought it might wear off before the end of the season, and that's changed. The thinking on that has changed in the last several years, to where there's more evidence now supporting that the vaccine and people that develop the immunity, that it does last throughout the season. So while we do recommend people get it as soon as it's available, for those reasons, just because we want them, if you're going to get the vaccine, you should get it and be protected as early as possible.
Mm-hmm. Because
remember, the flu season starts usually, it can start as early as November. Last year was a little different, it even started earlier, but that was a special situation. But it can start early, and remember, it takes several weeks to develop those antibodies. So we want people to get it as soon as they can. We don't want people to miss vaccination opportunities. That was another concern with waiting, with people thinking, well, it's too early and I'm going to wait until October or November, and maybe they might get busy, or maybe they may not have a doctor's appointment or be able to get into one of the health department clinics and get that vaccine, and they may end up actually never getting it at all.
Do you foresee a shortage this year?
That's always hard to predict because we never know what the season will look like or how many people will want the vaccine. But it is thought that there will be enough vaccine, seasonal flu vaccine, for the people that want it. If the patterns of people wanting who desire to get the influenza vaccine remain similar, there should be enough.
Now, seniors, do they typically go to the doctor's office for their shots, or do they go to the clinics that are around the county?
Well, a flu vaccine is available at many different sites throughout the county. Some people do go to their doctor's offices, to pharmacies that are offering it now. The health department has offered influenza vaccine for many years. We offer vaccine to everybody that medically can take it, 6 months and up. We don't have any age restrictions. So many people, families and older adults, do find it convenient to come to our clinics, which we have throughout the county. We've offered them at mass clinics and at other venues as well. Some geared towards families, sometimes geared towards older adults or towards everybody.
Okay. Dr. Lisa, we are going to take a short pause, and we will be back, and we will be talking about other tips on the flu season.
Now is our time to work as one. To create something beautiful. To start again. To ease a burden. To provide hope where there was none. There's so many ways to create the good. What will you do?
Start creating the good by visiting iparticipate.org.
Welcome back. We are continuing our interview with Dr. Lisa from Medina County Health Department discussing flu season. I have $1 million question for you. How much will a flu shot cost? Everybody wants to know.
Well, the health department does have a fee for the influenza vaccine. We do take most Medicare and Medicaid plans, so we can bill those. And people can find out the information on the costs from our website.
In today's economy, is it a reasonable price, or
it's on
it
par
fluctuates?
with it's on par with what other other facilities charge.
Is it one shot this year or is it 2 shots?
It's just one shot this year. Last year was an unusual situation with the 2009 H1N1 outbreak. As I'm sure everybody remembers, this was an outbreak. It was our first outbreak in over 40 years, outbreak of influenza. And it started in the U.S. in April of 2009. A little bit too late for a vaccine to be developed and included in the seasonal flu vaccine. Normally, what is given with the seasonal influenza vaccine is 3 different strains. It's called a trivalent, 3 strains in one shot. 2 of those are always an influenza A, and 1 of them is an influenza B. So the seasonal flu vaccine had already begun development and production, and it was decided to manufacture an additional influenza vaccine against the 2009 H1N1 flu. So last year it was recommended to get 2 different flu vaccines. This year, fortunately, the 2009 H1N1 virus that is still expected to circulating, it is still circulating around the world, and it's expected that it will continue to circulate this season. So it was decided to include that in our seasonal flu vaccine. So we just have the one trivalent, again, 3 strains. One of them is the H1N1 vaccine. One is another influenza A, an H3N2 influenza A strain, and the 3rd strain is a B, influenza B strain. So most people will need just 1 shot. Children that are under 9 may need 2 shots. It depends on how many influenza vaccines they've received in previous years. But everybody 9 and up will just need 1 shot.
And then for the seniors, is it a higher dosage?
There are several different formulations of influenza vaccine available. One is the influenza shot, again, the inactivated or killed vaccine, that's the shot. The other vaccine is a live intranasal vaccine that has been out since 2003. That vaccine is called Flu Mist. And it's actually only given to people that are between 2 and 49 years of age. So anybody 50 and over is not approved to get that vaccine. Among the injectable killed vaccine, there are now 2 different types. One is new this year. It's called high dose Fluzone influenza vaccine. It is only for people that are 65 years of age and older. And this vaccine was developed because we know that people over 65 do not respond as well immunologically to vaccines as people under 65. So there have been a couple ways around that. One has been an effort to immunize other people around the seniors, especially children. And that's been quite effective in reducing illness among older people. But a new concept this year was to increase the amount of antigen, or the virus protein that produces the immune response. The high dose vaccine has 4 times the amount of antigen as the regular dose. And it has been studied in older people over 65, and found that the immune response is better in people over 65 that got the high dose compared to people over 65 that got the regular dose of influenza vaccine. So we are hopeful that it will be more protective against influenza illness in those people.
Are there any side effects?
The side effects are the same. Soreness at the injection site, mild muscle aches, headache, and they tend to be mild. They were a little bit more frequent in the group that got the higher dose compared to the lower dose. But the people in the higher dose group also had the better immune response. So because of that, because it's still being fairly new, There is no recommendation one way or the other. Seniors may receive either the high-dose vaccine or the regular dose vaccine. People under 65 cannot get the high-dose vaccine. It's only approved for people 65 and older. So under 65, they would either get the regular dose flu shot, or if between the ages of 2 and 49 and healthy and not pregnant, they could get the intranasal flu mist live vaccine.
Okay, when the senior wakes up in the morning or even midday and she has achiness and she's just not feeling really well, what symptoms should she look for that she's realizing she does have the flu?
Well, symptoms of the flu, the most common symptoms are fever, headaches, chills, muscle aches, and just generally feeling ill. And they can be very severe. Sometimes people get influenza mixed up with other illnesses like colds. But when the illness is severe with a fever and the muscle aches, that's very likely to be the flu. We don't usually see things like nausea, vomiting in people with the flu, except for in children. That can occur in children. But when the symptoms are more intestinal in nature, it's not likely to be the flu. It's more likely, even though sometimes that's called flu or stomach flu, that's not the same as influenza. That's usually caused by a virus or a bacteria that can be either spread person to person or through food.
How can we prevent ourselves or protect ourselves from getting the flu?
Well, of course, getting a flu vaccination is the
Besides
best
the
way to
shot.
protect ourselves. Other ways are frequent hand washing. Remember, the influenza is spread person to person. It can be spread by touching contaminated objects. So hand washing is very frequent.
Important.
We can protect others. Certainly people that are ill should stay home and stay away from others, try to stay away from infecting other people. But hand washing, frequent hand washing is important. Just generally watching out for one's general health by eating right, not smoking, getting plenty of exercise and getting plenty of rest also helps boost one's immunity as well.
Now, you will have clinics throughout the county,
Yes.
and that should be on your website.
But
If Mrs. Jones could not come into any of these clinics, do you go to the homebound seniors?
we have several accommodations for people with special needs. People that absolutely cannot get out of the house can call the health department and speak with a nurse about the possibility of arranging a home visit from a nurse to give the vaccine there. The other options we have for people that can get out but they have difficulty walking or standing in line is that we have special drive-through clinics for people that cannot get out of the
wonderful.
car and actually walk into the clinic or stand
Good.
in line for long periods of time. These are clinics where, just like it sounds, the person stays in the car. There's a line, of course, the cars form a line. A nurse will come out to the car when it's that person's turn, take care of all the paperwork, the questions,
Insurance.
question answer, the insurance or payment, whatever, everything, right there in the car. So this service is it's really meant for the convenience of people that have difficulty walking or standing in line. Now, some people, any adult, it's not really geared towards children. Any adult can go through the drive-through, but they should keep in mind that it's not necessarily faster. It can actually take a little longer, so people that are in a hurry that can walk and stand in line might be better served by coming to one of our regular walk-in clinics. And the other option for people with special needs, including children with special needs, is just to go into one of our regular walk-in clinics, but to notify a greeter. We always have greeters out front or either right inside or outside the door or in the parking lot that greet people when they
okay.
come in. If they let a greeter know that they have a special need in their family, then that person can track them quickly into a special needs area where they will not have to wait in line.
And when you call the health department, is there a special line for the flu versus all your other departments?
Just our regular telephone number, 723-9688. There are hotlines available for adults and for family information regarding influenza. And with any more specific questions, one can always ask to speak with a nurse.
Okay. So our job is to get out there and get our flu shots and be healthy during the season and not be carriers, you know, with the germs to pass
That's
it on
right.
to somebody else.
Influenza vaccine is still the most effective way to prevent the flu. And remember, the flu is it is a serious disease and can cause serious complications. And so we do recommend people get a flu shot if they can. And
no two people are going to have the same type of flu. You know, our bodies are all so different. You know, one could be over it in a couple days, and the other day it might linger, depending on your health.
Correct. There are certainly different strains of the flu, and everybody responds differently. Some do have a more mild illness that may just last 2 or 3 days. And some people may be ill for much longer, be hospitalized, or have a severe complication.
And if it lingers, then they need to address it with their doctor.
Yes, if it persists, if any very serious life-threatening symptoms occur, such as difficulty breathing or severe shortness of breath or confusion, or if the illness seems to get better and then suddenly gets worse again. That could be a sign of a pneumonia or another serious complication. And those people should seek medical care right away.
Well, Dr. Lisa, we enjoyed having you with us today. You were a wealth of information.
Thank you.
So take Dr. Lisa's advice, get your flu shots, be healthy, because holidays are coming, so we're going to be mixing in with our families, parties, social events, so we all want to be in good health. So thank you for having us. And thank you for joining Golden Years, and we hope we helped you with some valuable information. Have a good month.
If you haven't received your free copy of The Source by mail, contact Cindy Schneider at the Hands Foundation by calling 330-273-4308 or 216-780-4135.